So what is telemedicine? I mean, in short, basically telemedicine is any time where you're not in the same room with the patient. So like anytime you use, telephone, video, chat, Zoom, and anything like that, anything that's considered to be remote um, care of patients is considered to be telemedicine. History of telemedicine, like a lot of things in our country here in the United States, were started with either the government and or wartime and or space technology, and that's not the exception for telemedicine. Um, and usually you have historically have a couple uses of telemedicine. Patient education, medical imaging, real-time communication. Smartphones, became popular several years ago, and that's really changed the landscape of EMR and healthcare delivery. COVID, so prior to COVID, prior to the pandemic, telemedicine was kind of making a slow march, little by little, kind of gaining ground. But telemedicine really the pandemic really accelerated that. I mean, basically, healthcare providers were forced to adopt telemedicine. They didn't have a choice. They had adopted telemedicine, and they had to shut down their practices. Now we're kind of seeing a slight shift back to inpatient care, but I mean, I think telemedicine is definitely here to stay. You had companies like Teladoc and Amwell, up by 150%, 120% before, from prior to the pandemic, after the pandemic. And here in the United States, these are pretty well-known acute care telemedicine. Just real quick, I categorize telemedicine into almost, four categories here, but almost like two separate. One is based on mode of delivery. The other is based on kind of the mode of care, kind of. So you have, synchronous, asynchronous, or store and forward, and then you have, and then you have also, and on the other side, you have acute and you have disease specific.